You know, everything that's been going on in our world the last couple of months, I think has led us to ask a million questions and to try to figure out what's, you know, going on. And what's really interesting to me is that I've been working on the Spanish flu actually for quite some time. As Melanie mentioned, I did my doctoral work in London. At the end of my degree, I was on a postdoctoral team that was looking at modern pandemic and modern pandemic planning. As part of those conversations with a bunch of doctors and public health officials, I said, well, you know, this isn't new. We've had lots of pandemics before. And don't forget the Spanish flu of 1918, 1919. And several people in the room had never even heard of it. And I think that's an interesting idea, is that this is very much a forgotten pandemic. The other thing for me that makes this quite personal is that I realized just a few years ago that my grandmother actually had the flu during the Spanish flu. She was an infant. She was about 3 months old at the time that she contracted the flu, but her family was obviously deeply concerned about her health as a newborn baby. So for me, I've realized, you know, there are lots of different connections to this particular event. If it's all right, Melanie, I'm going to share my screen. And let's talk a little bit more about the pandemic itself. So the Spanish flu is something that has very much become part of our conversations the last few months. But this is somewhat of a change. And it's really quite interesting to think about how historical events come into our consciousness and go out of our consciousness, and then can sometimes come back roaring, particularly with the current pandemic that we're facing. So I'm going to advance. So the first question I want to ask is just, you know, what is the Spanish influenza epidemic? Well, it's an outbreak of the H1N1 virus, which we've heard of before. And this is the one that we talk about when we talk about our seasonal flu. This is one of the most virulent strains of the flu virus. And so the goal is to not have to deal with this particular strain of the virus. And this is what makes the Spanish flu such an aggressive and such a deadly virus. Roughly 500 million people globally were affected. That's about a third of the world's population. And though the numbers are difficult to determine, and we're going to talk about that because actually this is something that makes the experience of the flu in Alabama so important, is there are roughly 50 million deaths globally. The problem is we don't exactly know how many people died of the flu because of inaccurate records and a whole other host of challenges that people faced in 1918 and 1919. Of those 50 million dead, roughly 675,000 were in the United States, and somewhere around 10,000 Alabamians died during the pandemic. One thing that makes this pandemic different than a lot of others is that there's a particularly high mortality rate for those between the ages of 20 and 40, which is usually an age we think of being the most robust, the healthiest, the most active. And yet that's a population that's very much struck down by this particular pandemic. And it is one of the deadliest pandemics in modern history. So when we look at these types of numbers and compare them to the current pandemic that we're facing, we can see that this is obviously a truly global event with catastrophic consequences. So one question we always get when we talk about the Spanish flu is, why is it called the Spanish flu? Well, I want to start with one or two other little points. First off, I'm going to use the word epidemic because that's typically how it was referred to historically. We obviously will use the term pandemic a lot, especially as we talk about current events. And what's the difference between a pandemic and an epidemic? Well, basically, the best definition I got was a pandemic is an epidemic with a passport. Pandemics are global, pan. And so when we think about this, we want to think about kind of a local experience versus a global experience. The Spanish flu is absolutely a global experience. Its likely origins, though, are not in Spain, as you might think with the name Spanish flu. It starts potentially in Fort Riley, Kansas. We don't really know for certain where it begins because, again, we're back to things like inaccurate records. We've got a lot of communication challenges that still exist in 1918, 1919. Medical advancements are coming, but we're not quite there in our full understanding of viruses. There are early cases that show up in New York City, Eastern France, Western Germany. Now, any of you history teachers, of course, when you say Eastern France and Western Germany, 1918, yeah, we're in the midst of the First World War. And that's one reason why this gets the name the Spanish flu. Due to the very strict censorship in most of the Allied countries during the First World War, the first media reports that start to emerge about this influenza pandemic are coming out of Spain. Now, the idea of taking a flu virus or any kind of disease and ascribing it to something foreign is not new. And we actually can look at numerous pandemics that exist in the late 19th and early 20th century that get ascribed names that that will give it a sense of foreignness. And so xenophobia is a big part of how we name diseases. The Russian flu in 1889, Asian flu, Hong Kong flu, and we've seen with our current flu pandemic evidence of xenophobic behavior as we talk about the origins of disease, but also the transmission of disease. And so the Spanish flu isn't really Spanish at all. It's arguably from Kansas, but it gets this name because it's the first time we see those media reports. The Spanish weren't afraid to talk about it, and they had very detailed reports about the outbreak, and it even affected all levels of society, from the royal family down to a typical peasant community. So they were reporting it in far greater numbers. And here's an image of what happens in Fort Riley, Kansas. So what I think would be hard for us to imagine today with our modern healthcare system is that, and we've talked about that idea of our healthcare system being overwhelmed by the number of sick patients. And so this idea of flattening the curve, which is a phrase that we've all heard in the media, this was something that was not understood and was absolutely impossible to do. And you can see here, this is a gymnasium that's been turned into a makeshift hospital. And I mean, you've got doctors, nurses, and patients that are just crowded into these facilities. Fort Riley, Kansas saw an outbreak of several thousand cases over the course of 2 weeks. So imagine going from really 0 cases to several thousand in just a matter of days. And so they're overwhelmed. They've got obviously challenging conditions. And I can't even begin to imagine what it would have been like to have been a nurse or a doctor working in a facility like this and trying to comfort patients, but also to ensure their health and safety and the health and safety of the doctors themselves. So what makes this pandemic different? We've talked just a little bit about this, but it's really that dramatic impact on people between the ages of 20 and 30, 20 and 40. And the reason for that is that we experience, when we get the flu, get the real flu, not just a cold that we sometimes call the flu, is that we get that aches and pains all over the body feeling, and your whole body feels like it's sick. And that's something called a cytokine storm. And I'm not a medical doctor, so the medical professionals can give you a much better understanding of this, but it meant that many people went from being perfectly healthy one day to being gone the next. And so it's the very rapid expansion of the disease across a large population, and particularly those that were healthy and those from the healthiest part of our age demographics, and the fact that it was so quick. And for many, the death was almost a matter of hours. It's also that it's really global in that it's happening in a condensed period of time compared to other global pandemics. We can talk about the Black Death. That takes place over a series of years. It's actually even arguably several decades. Even the Russian flu in the 1880s, which is argued by some historians to be one of the first global pandemics, is still about a 3-year period of time. The Spanish flu is really global within a few weeks, and its very high global mortality rate, again, these numbers are always subject to evaluation, is really somewhat unheard of. Nobody's experienced this. It's dramatic. Entire families are being impacted. Whole communities are being impacted. And it's hitting those that are the healthiest, the most robust, and the most active within a society. Now, there's a reason why it's global, and it's global so quickly. And that's because we have to think about the timeline. It's 1918. We're at the end of the First World War, and all of these troops are being discharged and sent back home. So we're going to be packing a lot of 20 and 30-year-old young men onto trains, onto troop ships. All it takes is one sick passenger. And that disease is going to basically spread along rail lines, along shipping lanes. And when you look at maps, particularly in Europe, you can watch the first reported cases. It's almost as if they match the stops on the railroad. So we're seeing this kind of dramatic expansion of the disease and the contracting by so many different people in such a quick period of time, that this is why the Spanish flu is so different than anything else others have experienced. So what happens in Alabama? This is a disease that does not leave Alabama alone. And what's interesting is when we look at the timeline. And so I'm going to go through these and talk just a little bit about some of this, but you can really see how quickly the disease is spreading. The first case in Alabama is arguably reported in Huntsville on September 28th. By October 5th, Huntsville has 1,100 cases. So that's just showing how quickly this disease is spreading. The state does act relatively quickly, and the governor shuts down schools, churches, theaters, and picture shows. So you can't go to the theater and you can't go to the movies. You can't go to church and you can't go to school. Now, these are relatively short-lived prohibitions. It's actually only for about 2 to 3 weeks, but it is considered to be valuable in slowing the progression of the disease. One thing they do understand is putting people in confined spaces that are poorly ventilated isn't a good idea. And these are obviously the entertainments that people would have enjoyed. Birmingham converts over its high schools to emergency hospitals. So we can see that the first case is September 28th in Huntsville. By the time we get to October 8th, Birmingham has already seen its hospitals overwhelmed. October 13th, Camp Sheridan, which is just outside of Montgomery, has reported over 2,000 cases. Huntsville's pandemic is expanding so rapidly that by October 13th, there's only 1 doctor and 1 pharmacist that have not been stricken. And so the ability to provide care is almost immediately crippled. So anyone who's even got medical training is almost immediately becoming ill. So we're going to see this as one of the big challenges that Alabama faces, which already has an underdeveloped healthcare system in 1918. And we'll talk a little bit more about that in a second. But even those that are trained to provide medical care, it's limited. So the care is going to be provided at home. It's going to fall to families to care for their loved ones. Here are 2 nurses, 2 pictures from Camp Sheridan, and you can see the very traditional nurse uniform. And then I think what's also, I love the photograph of the nurses in the kitchen. They don't, if I had to say, when you're talking about 2,000 cases, they're not prepared. They don't have the resources. And you can only imagine the pressure that they're under, the hours that they're working, the experience that they're having had to have been absolutely overwhelming. And so imagine using those very limited facilities to care for thousands and thousands of sick individuals. By October 15th, Huntsville is closing down businesses. October 22nd, Montgomery has 12,000 reported cases. But just as quickly as it's expanding and affecting so many people, the state does begin to reopen, because even by early November, we're starting to see a subsiding of cases. Now, they are recommending masks. There's a great article that you can find. Birmingham health officers are saying you have to wear a mask. And one way to do this is the police are doing them to encourage the public to participate. But it's not over. In December, we see a resurgence of the disease in areas like Selma. And then there's a 3rd spike in early January of 1919. Now, when we talk about this impact and we go through this timeline, we can see there's lots of reporting being done on a local level. And so you're seeing reports from health officers and you're seeing accounts from different individuals. But we also have to remember these are the reported cases. These are individuals who are actually going to hospitals, they're seeking care, medical officials are aware of them. we're talking about Huntsville, Birmingham, Montgomery, Selma, larger cities, urban areas comparatively to the rest of the state. But this isn't just hitting the cities. This is also hitting rural communities particularly hard. And so one reason why it's difficult to come up with real statistics is because in Alabama, we have a healthcare system in 1918 that is segregated, it is limited, and it's often inaccessible. An individual may have to travel nearly 50 miles to a hospital. Now, that may not seem like much to us today, but in 1918, we're doing that on foot or by horse and buggy. So individuals are unlikely, especially when we talk about the rapidness with which this disease progresses. So individuals might be, perfectly healthy on Tuesday and might be deathly ill by Thursday. The last thing you want to do is go 50 miles in a horse and buggy to the local hospital. So getting to adequate health care is extremely difficult. Death statistics are imprecise. A lot of deaths are unregistered. In smaller communities where you didn't have adequate health care, maybe didn't have a doctor, especially those that are outside of kind of county economic and political centers, deaths are just going unregistered. Graves are being dug in front yards. In some cases, even mass graves. Entire families may die. And so they would just come in, they would bury the whole family and move on, but no one would register that death. No one would give that information to the authorities. So 10,000 is in a lot of ways a guess. It could have been much, much more, and likely was much, much more. And we do even have examples of graves in the Florence area where I live, in which there were mass graves dug for workers. And a lot of those were immigrant workers. So there weren't adequate records of where they were from. This was well before we had a sophisticated immigration and naturalization service. And so some of those mass graves still exist there on industrial sites where individuals, they succumbed to the disease, they were buried, and their families never even knew their fates. A quote from one doctor talks about just the dramatically overwhelming experience they had. We worked like dogs from about 7 in the morning until the last patient of the day had been checked in or out, usually about 10 o'clock that night. The men died like flies, and several times we ran out of boxes to bury them in and had to put their bodies in cold storage until more boxes were shipped in. It was horrible. And so you've got a medical system that is overwhelmed almost instantaneously. But then it's also the overwhelming of that post-care system as well. There's a photo from the Bellamy Planning Company in Florence. And this image shows the wood being cured to build coffins. They went to 3 shifts a day. They could not build enough coffins in order to even just to supply the local area. So some of these were getting shipped off to other parts of Alabama, but the vast majority of them stayed in the Shoals area and are being used to handle the large number of deaths that all of Alabama is experiencing. How do they treat it? Well, in some ways, you've got to treat the Spanish flu almost the same way we would today. It's a virus, so there's not a lot you can do. But their knowledge of viruses was particularly limited in Alabama. Now, there's greater understanding and development in medical care in other parts of the U.S. and around the world, but Alabama was still behind. Outside of those larger urban areas, Birmingham is starting to see the emergence of its medical culture. Montgomery has several hospitals, but if you were out in the rural parts of Alabama, you just really didn't have access to much medical care at all. They tried to control the fever. They tried to provide fresh air, clean linens. But for the most part, we see folk remedies are being used. One was the belief that sliced onions would have a significant impact on one's ability to fight off the flu. And so there was a run on onions because, of course, this is wintertime when this is hitting kind of November, December, January for the first time. And so all you have are the onions that people have stored from their summer harvest. So onions became tremendously expensive. So having onions was a good thing. Whiskey. I guess it's one of those, they saw it that, it's medicinal in a sense that the alcohol can kill things, but I'm not sure giving a sick patient large amounts of alcohol would be seen today as medically appropriate. One thing that was really fascinating was that parents were noticing, and this was a more common treatment for children, they were noticing that factory workers and those that worked in mines were not getting the disease at as high a rate. Now, this is really misleading because it's likely they were actually getting the disease at an equally higher rate, but this is kind of one of those rumors that spread very quickly. And so parents would take their children to factories that didn't close and have their kids inhale the industrial fumes. So inhaling smoke from the steel plants. And so I can't even begin to imagine doing this with a child, but taking your child to the factory and having them stand downwind. And this was seen as supposed to be healthy for the lungs, which of course we would know not to be. Quinine was also a typical treatment. There was a belief that this was very similar to malaria, and so quinine, a treatment for malaria, could be used. And then good old-fashioned chicken soup. It's the same thing that we probably have had every time we've had the flu. That's not a new remedy, and you can, of course, imagine that families were just trying to keep people hydrated, keep people fed. So, the normal things. There are also all kinds of examples. Particularly, there was a belief in drinking milk. And then you'd see an article come out that was a prohibition on milk, saying, no, don't let anybody drink milk. You also had a lot of people who exploited this situation and developed tonics and potions that they sold as cures, or more critically, they sold as preventatives. It's going to keep you from getting the flu. And so you can only imagine how people, in the fear and anxiety that existed as the disease was spreading so rapidly, and it was affecting so many young people, people could be easily swindled by charlatans who were selling items that just, had absolutely no medicinal quality whatsoever. The other question we want to ask, and we're going to talk a little bit about this kind of with the bigger impact of the Spanish flu, is how does it affect different people? One of the things I think that's important to remember is, of course, that women took the lead in these events. We will occasionally see quotes from medical officials and doctors, but really it's women who are on the front lines, providing nursing care, and they're often having to do this with little or no training. The nurses that are already trained and working in hospitals are going to be the first ones to get sick. Someone's got to take their place. And so really anyone with minimal kind of, I would say, care qualities could be drafted to go into these hospitals. We also see, of course, the reliance of people being cared for at home. So it was often grandmothers and mothers and daughters that were taking care of the ill. And this made them even more susceptible to contracting the disease themselves. African American girls and women were often trained as nurses, but interestingly, they were only asked to serve in white hospitals. There are horrific examples of stories of exploitation, particularly of African American girls, that could be trained to care for wealthy white families, because the idea was that they were expendable. Society did not view them with value, did not see their training as being something of value, and so they were often put to work treating families or caring for families. And unfortunately, because there were laws that prevented white nurses from treating Black patients, it meant that disproportionately the Black community will suffer during this. And we see that too, impoverished populations are going to suffer even greater numbers than the wealthier families. Poor sanitation, poor living conditions, particularly the lack of access to clean, fresh water, the lack of ventilation, cramped living conditions, are all going to contribute to people suffering in greater numbers. I've got here an article from the Auburn Spirit, and it is interesting to think about that all kinds of media reports are going to exist. But one thing I think that's interesting as we read about this is that it refers to the nurses, and we see a very, very clearly that gender breakdown. So we talk about these ladies nurse the sick. We talk about all kinds of women who are taking on extremely difficult and very dangerous work to care for the sick populations in their areas. And this is not just something unique to Auburn. It happens all over the state. It happens all over the country, arguably all over the world, that individuals stand up and they take on this burden. But I think seeing that very gendered language is something that's important for our students in our classrooms to see as well. And so this is a great opportunity to talk about those gender stereotypes and gender roles that we don't often have a chance to do with other events or take the opportunity to do. So why does this have such an enormous impact? Well, the Spanish flu in some ways is related to all other modern flu outbreaks, and it will always be, to a great extent, the kind of the benchmark of the modern pandemic. It is so virulent and it is so deadly that actually the average life expectancy for an American man drops by 12 years due to this flu outbreak. So we're talking about something that's striking at really the heart of society. It's healthiest, it's most productive. But here's the bizarrest thing. By the 1920s, the late 1920s, it's virtually forgotten. It is absent from history books. It's absent from conversation. Now, people will say they remember it and they'll talk about loved ones that are lost. And you can walk through cemeteries in Alabama and you see a lot of death dates at 1918, 1919. But for some reason, about a decade later, it just fades completely from our consciousness. And it's really only resurrected in the late 1990s as we start talking about things like bird flu, and we talk about the SARS epidemic in the early 2000s. Do we start going back and thinking about these previous events? So we have a huge chunk of time where this forgotten pandemic also means we forget to collect the stories, the documents, and the evidence of this pandemic, the experiences of this pandemic, which is going to make a real challenge for us as historians and as teachers to ensure that we're teaching this in a comprehensive way. You know, there are little things that last. Many of you may know the rhyme "Ring Around the Rosie" that perpetuates from the Black Death. The little rhyme that came out of the Spanish flu: I had a little bird, its name was Enza, open the window and influenza. So children will learn to cope, children will learn to explain, and we see this in literature and music and stories. It's still there, it's just not talked about in as overt a way. And also, of course, the Spanish flu perpetuates this idea of disease as foreignness. It perpetuates the xenophobia that comes with these types of pandemics. So again, the xenophobic behavior we might be seeing in some communities today is not new. Unfortunately, it's actually quite a common occurrence. We like to see these things as not part of our own society, and therefore eradicating it can also have consequences for immigrants and other marginalized populations. Now here's a big question, and the big question is, how do we teach it? And so this is where, as teachers, we have to really think about some of the things that we can do in a classroom, but there's a big philosophical question we have to ask ourselves, and is this a separate event, or is this an offshoot of the First World War? Now, the First World War is not something we teach as comprehensively in American classrooms, because the First World War isn't arguably an American war. Our involvement is extremely late, and in many cases, the aims and goals of the American government and President Wilson are virtually unfulfilled, or almost completely unfulfilled through the peace process. And then we move in very rapidly to the Jazz Age, to the Great Depression, and into the rise of fascism and the Second World War. It's not like we don't have a lot to teach when we're looking at the first half of the 20th century. So to a certain degree, we have to argue that some things are just going to get cut. Unfortunately, what's happened is Spanish flu has been one of those things. And so I do think it's important to look at it almost really two different ways. One is to see that the spread of the disease occurs because of the end of the First World War and these troops moving back and forth across the Atlantic in particular, but really to teach it as a modern pandemic. Now, that may be a whole lot easier to justify because of the current situation with COVID-19. It's going to be in the consciousness of our students and in the consciousness of our students' parents. So we have something to base this on, a shared experience. So I do think it's important to be mindful of which way you want to philosophically approach it. There are a lot more materials out there, primary source materials, and I know in the packet you're going to get related to this particular seminar, you'll see links to letters and photographs. I've already shown you several, and we can go back and talk about those, how we can get students to analyze those letters, newspaper articles, the photographs, and bring in those personalized stories. Unfortunately, what has happened, because again of the forgotten nature of the pandemic, is we don't have a real comprehensive and inclusive body of documents. Oftentimes we're seeing the material skewed. So it's not the nurse that gets quoted in the newspaper, it's the medical officer, which is typically going to be a man. The nurse is typically going to be a woman in 1918. So those gender roles, we're not seeing those firsthand experiences and accounts that have been kept and preserved. Sometimes they're being preserved through family letters, sometimes they're being preserved through oral histories, but they're not something that we find in the newspaper or in the official documentation. We also see that marginalized populations, in particular in Alabama, the Black community, is almost completely left out of the conversation about Spanish flu. But we know it's impacting these populations often in even greater numbers because of a lack of adequate health care, isolation, being in rural communities where they don't have access even to those urban centers, and then of course poverty and the living conditions and sanitation that come with that. So we do have holes in this that are really challenging, and it does mean that as teachers, when we're trying to find ways to tell inclusive stories, we have to dig a little bit deeper when we come to the Spanish flu to try to find those experiences to make sure that our students are seeing as a big a cross-section of the experience in our state and country as any other. We've got a great opportunity for comparing and contrasting the Spanish flu and obviously COVID-19. That's something that we can draw on. What are our students seeing, thinking, feeling in these current events, and how then can they find correlations to previous events? As this current pandemic comes to an end, I think we all are hopeful that it comes to an end soon, and that we can return to some level of normal behavior. We'll have two complete pandemics that we can do comparison and contrasting on. And then we can also use this as a great opportunity to go across the curriculum. I don't think we can ever discount that enough. Bring your science teacher in to talk about viruses themselves and see if you can correlate those two units within the curriculum. Talk to the math instructors about how to bring in statistical analysis and look at the numbers, look at demographics, and look at how different states are impacted. Talk about these literary sources and look at ways in which literature continues to tell stories, often in a subversive way and often without direct reference to the events. But that's a way that we can talk about how, in a sense, history gets told down the road. And it's really important to show that students can learn from these other sources. And then I think, too, it's great to bring in your art teacher and talk about photo analysis. To talk about the artists that emerged during this period, and again, how some of these events are reflective in their art and the experiences that they're sharing through different media. And so we can really use this as a great way to work across the curriculum and get our students to see the integrated nature of all of our disciplines. There are so many sources out there. What's interesting is that this gives us a chance often to go towards sources that we typically wouldn't use in other ways. So the CDC has great material on this, and they have pulled a lot of historical documentation to show what's happening and kept a lot of the very few primary sources and oral histories that have been collected. There's, of course, the National Archives. The Library of Congress has great information. Our Alabama State Archives has a phenomenal collection of documents and some materials for teachers that are extremely valuable so that you can pull even completed lesson plans off those websites. There's the Influenza Archive, has a great collection of images, which of course we always want to use with our students in PowerPoints. And again, I think it's important to use them as primary documents as well. And then there are great newspaper databases. So you can pull from all of the major Alabama newspapers, and the Birmingham News, the Montgomery Advertiser, the Huntsville Times, all have either they're in existence or they have precursors that are all pretty much part of these major newspaper databases that are out there. So you can draw from those resources as well and find things for your students to use that are much more concrete and immediate. And I think that's a really key idea for us when we want to make this available to our students.